Hello students. We all know that stress is generally defined as any event or situation that poses risks to our physical, social or psychological well-being. Research has proved that stress has both indirect as well as direct connections to disease. Today we are going to understand some health-related problems which have direct relations to stress. We'll be discussing 3 health-related issues. The first is peptic ulceration, the second are sports injuries, and the third is asthma. First, we go on to a lesser heard disorder, that is peptic ulcers. A peptic ulcer is an ulceration involving the gastric mucosa and other deeper structures in the gastrointestinal tract. Now you may ask me, what is the gastric mucosa? The gastric mucosa is the tender inner lining of the stomach that is comprised of soft epithelial tissue. Now this umbrella term of peptic ulcers includes gastric ulcers, esophageal ulcers as also duodenal ulcers. Now how do we differentiate between these 3 types of peptic ulcers? They can be differentiated on the basis of where exactly they occur within the gastrointestinal tract. Say for example, a gastric ulcer usually occurs on the lesser curve of the stomach, and as a rule only one ulcer is present. Similarly, duodenal ulcers, as the name suggests, are often associated with a scarring of the duodenum. Now the duodenum is the smallest or shortest and the first part of the small intestine. And the main function of this part is the absorption of the food we intake. And as compared to gastric ulcers, duodenal ulcers are often chronic and they are difficult to heal also. Now the third type is esophageal ulcers. Again, as the name suggests, it occurs in the distal esophagus. Esophagus is the tube through which food passes from the pharynx to the stomach. Now this peptic ulceration can either be acute. When it is acute, it is usually superficial, involving only the mucosal layer. But when it is chronic, it is deep and involves both the mucosa as well as the submucosa. Another interesting fact is that peptic ulcers are more common in men, that is 4 times more common in men as compared to women. Now we go on to the symptoms of peptic ulcers. One major symptom of peptic ulcer is abdominal pain. It can be epigastric or during the meal, and this is especially the case in gastric ulcers because more gastric acid is released in the stomach when you eat. When it comes to duodenal ulcers, this abdominal pain occurs 2 or 3 hours after you have taken your meal. This is because it takes 2 or 3 hours for the food as well as the acid to pass on from the stomach into the small intestine. Now typically ulcers tend to heal, they again recur, and so the abdominal pain may also subside for a few days, then you may again have abdominal pain, and again this process goes on. Another symptom is bloating and a feeling of abdominal fullness, also nausea and vomiting, a loss of appetite as also a loss of weight. One major symptom, especially in chronic cases, is hematemesis or a vomiting of blood. Either it can occur directly from the gastric ulceration because it has become too chronic or eroded, or it may occur due to the damage to the esophagus during severe vomiting. Another very severe symptom is melena or foul smelling feces, black tarry feces. This happens due to oxidized iron from hemoglobin, which is a result of gastrointestinal hemorrhage due to severe peptic ulcers. Now in rare conditions, especially when the peptic ulceration is extremely severe or chronic, there can be perforations in the gastric or duodenal sectors. Perforations, in other words, means that there will be a puncture or a rip apart of the stomach or the duodenum. Another severe phenomenon which can be observed is a penetration of organs which are adjacent to the gastrointestinal tract, and in severe cases, stomach cancer can also be a possible outcome. Now that we have seen what peptic ulcers are and what are the major symptoms of peptic ulcers, we'll go over to what are the major causes of peptic ulcers. Research has revealed that the major cause of peptic ulcer is the bacterium Helicobacter pylori. It is a major causative factor for nearly 60% of gastric ulcers and almost 90% of duodenal ulcers. Now, what is the action of this bacterium? This bacterium, Helicobacter pylori, causes a chronic inflammation in the antral mucosa. This chronic inflammation results in chronic active gastritis. Active gastritis either results in an increase or a decrease of gastrin in different parts of the stomach. In places where the secretion of gastrin is increased, there is a corresponding stimulation and an increase in the secretion of gastric acid. Now, when the amount of gastric acid increases in your stomach, it directly erodes the tender inner lining or the mucosal layer, and peptic ulcers are produced. Also, this gastrin creates an acidic environment in the stomach due to the excess secretion of gastric acid. And this bacterium, Helicobacter pylori, actually thrives in an acidic environment, leading to a further aggravation of peptic ulceration. Now we come to a second possible cause of peptic ulcers. These are drugs. Drugs, especially non-steroid anti-inflammatory drugs that inhibit cyclooxygenase, also corticotrophin, adrenocorticoids, and most glucocorticoids. Drugs such as dexamethasone and prednisolone include these properties, and an intake of these drugs, especially in high quantities, can lead either to a development or an aggravation of peptic ulceration. A third cause is hereditary factors, hormonal factors, personality factors. For instance, you have a very aggressive, irritable personality or type A personality patterns, as also environmental factors, especially stress. Now we come to the all-important topic, stress and peptic ulcers. What role does stress play in peptic ulceration? After a long-standing debate on the role of stress in peptic ulcerations, researchers have found that peptic ulcerations are not just caused by infections or bacterium, and stress can also play a vital role both in the development as also the aggravation of peptic ulcers. For instance, stress situations such as highly competitive work situations, traumatic life events, accidents, burns, head trauma, all of these can also have emotional correlates of stress. For example, you will become nervous, anxious, tense, unhappy, and all these emotional factors, especially those associated with chronic stress, they interfere with the normal functioning of the stomach, leading to an excess production of gastric acid. And gastric acid, as you already know, serves to erode the mucosal lining when the amount of secretion is quite high. Further, this excess production of gastric acid in stressful situations also leads to an acidic environment in the stomach, and it should be noted, as I've already mentioned below, that this bacterium, Helicobacter pylori, thrives in an acidic environment. Further, the stress response involves the secretion of glucocorticoids such as cortisol, which also are causative and aggravating factors for peptic ulcers. Further, an indirect effect of stress would be an increase in risky behaviors, for example, smoking, alcoholism, uninhibited and irresponsible drug use, as also irregular meal times, intake of spiced and high-calorie foods, all of which can act both as causative and aggravating factors for ulceration. Now that we have a general idea of what peptic ulcers are, we'll try to understand what is the process of treatment for peptic ulcers. The basic treatment for peptic ulcers involves dietary regulations, both in terms of the content of the meals as well as the timing of the meals. Doctors advise frequent small meals instead of a heavy meal so that the stomach never remains empty, because when the stomach is empty, the excess gastric acid produced directly acts on the inner lining of the stomach, eroding it. Also, avoidance of spiced and acidic foods, fried foods, behaviors such as smoking and alcohol, as also the use of other aggravating drugs, and extremely stressful situations need to be avoided. Other precautions include bed rest and proper medications to relieve the symptoms and allow the peptic ulceration to heal. In case there are a number of complications and the peptic ulcer is chronic and severe, surgery may be prescribed. Now we come to the second disorder or the second health-related issue that we are discussing today, especially in relation to stress. This is asthma, which is a quite common disorder. You may hear of it almost in your everyday life. Now, what exactly is asthma? Asthma involves a chronic inflammation of the bronchial tubes or airways. Bronchial tubes which are chronically inflamed become overly sensitive to different kinds of triggers. These may be specific triggers or allergens, or non-specific triggers or non-allergens, which in normal circumstances should cause little or no response. This heightened state of sensitivity of the bronchial tubes due to an overreaction of the immune system results in bronchospasms, swelling, inflammation, and a congestion and narrowing of the bronchial tubes. The cause may be a tightening or a constriction of the muscles of the smaller bronchi, a thickening of the lining of the bronchial tree, or an excessive increase in the secretion of mucus. This entire phenomenon can be referred to as bronchial hyperreactivity, or BHR if it is abbreviated. And this bronchial hyperreactivity results in breathlessness, coughing, wheezing, and hypoxia, or a decrease in the oxygen supply for the individual. It is likely that there is an actual spectrum of bronchial hyperreactivity in all individuals, but the fact is that the level of bronchial hyperreactivity in asthmatics is essentially more intense and more severe as compared to normal people or non-asthmatics. Now, what are the possible causes of asthma? Asthma can be triggered by a wide variety of factors. One point you need to note is that all persons or all asthmatics may not respond to the same triggers. Now, these asthma triggers can be divided into two categories. The first are specific triggers or allergens. These may involve seasonal pollens, plant spores, dust mites, animal hair, food items such as cow's milk, soy, nuts, peanuts, insect parts, additives, sulfides, or it may also include industry or work-related agents such as latex, epoxides, and formaldehyde. Non-specific irritants or non-allergens which can lead to asthma can include respiratory infections such as viral cold, bronchitis, drugs such as aspirin, non-steroid anti-inflammatory drugs, and beta blockers which are generally used for heart patients. Food additives and tobacco smoke can also be possible triggers. Additionally, outdoor factors such as smog, weather changes, diesel fumes, indoor factors such as paints, detergents, chemicals, certain odors or smells, perfumes, even deodorants, and even certain times of the day, for example night times, can act as triggers for asthma in certain people. In addition, gastroesophageal reflex disorder, exercise, especially when it takes place under cold and dry conditions, chemicals, dusts, gases, and essentially emotional factors such as crying, yelling, laughing, excessive anxiety, and anger can act as potent triggers for asthma. Heredity may also be another factor that can lead to the development of asthma, because you usually find that more members in a particular family have asthmatic symptoms. When asthma develops in childhood, it may actually be related to other diseases such as hay fever or urticaria, that is hives, and the symptoms of child asthma usually decrease towards adulthood. Now, what can be the possible treatments prescribed for asthma? One treatment may be breathing exercises, as also the use of bronchodilators which dilate the bronchial muscles and bronchial tissues, as well as the use of steroid inhalers. But one major factor is there are a number of preventive measures that we can apply if we want to escape asthma attacks. This would include trying to keep yourself away from potential triggers, as also maintaining a very de-stressful environment. Now we come to a very interesting topic in this lesson, that what is the effect of stress on this particular health disorder of asthma. Now, stressful situations are accompanied by emotional responses such as anxiety, anger, frustration, irritation, emotional outbursts such as crying and yelling. And all of these serve to be potential asthma triggers. Further, this very stress of facing an asthma attack or having an asthma attack in different situations, for example, a job interview or in a social situation such as party, can actually trigger an attack in itself. Further, when we are faced with extremely stressful and traumatic situations, we may engage in responses such as crying. Now, these responses lead to an increase in mucus secretion, and the breathing becomes more difficult as the bronchial tubes become even more congested. In addition, stress plays an important role in the weakening of the immune system, and the immune weakening results in an increase in the individual's vulnerability to a number of infections and diseases and a number of triggers which can actually cause asthma. The third health-related problem that we are going to discuss today and the influence of stress on this problem is sports injury. You may have often read in newspapers or seen in news reports how different players have to skip games and take rest because they have suffered some or the other form of injury. What is sports injury? Sports injuries are injuries that occur during athletic activities. We can divide them either into traumatic injuries or overuse injuries. Traumatic sports injuries generally range from bruises and muscle strains to severe injuries such as fractures or even head injuries. And essentially, they are followed by some sort of inflammation, pain, localized swelling, heat, redness, and a loss of function. Overuse injuries occur when there is repetitive stress on some particular part of the body. For example, the tennis elbow, where the elbow becomes sore and red because there is repetitive use and stress on that particular part. Sports injuries may either occur intentionally, either because players in your own team have some sort of jealousy towards you, or players in other teams you are competing with expose you to sports injuries for their own benefits. On the other hand, sports injuries can also be unintentional and may result from improper training, a lack of proper warm-up, a lack of proper equipment, or basically a lack of conditioning to the sports environment. Now, how does stress become related to sports injury? There is enough evidence which suggests that psychosocial stress can actually increase an incidence of sports injury. One of the theories is that stress interferes with concentration and players become less vigilant about the dangers surrounding them. They become less aware of cues or warning cues, and they fail to protect themselves. A second theory says that the extreme physical arousal that accompanies stress combines with the natural physical arousal which is a part of a competitive game, and this actually increases the muscle tension, and as a result your muscle coordination decreases and there is a greater chance of you being injured. For example, if a college student is performing in a game and at the same time he tense about other factors such as exams or low grades or some other family problems, there is a greater chance that his concentration will be diverted and there is a greater chance that he would be injured. Athletes who have a history of playing under chronic stressors, as also a large number of stressors, and athletes who have lesser social support in the form of family, friends, and significant others are more likely to experience sports injuries. The stressors that exist for sports person may be the same as they exist for us. These may include stressful life events, daily hassles, life changes, fewer coping skills or fewer coping resources, and so on. In addition, there may be certain particular stressors which exist for sports persons. For example, the pressure of high expectations both on a family level, a social level, and even on a personal level, as also the tension of being role models for others, of being ideals for others. All of this combines to create a large number of stressful situations for the sports person. And we can see that in many cases, they react with anxiety, depression, they may even develop eating disorders or substance abuse. Many a times, coaching decisions which are made in the favor of a game can actually put the players at risk. For instance, a coach may feel that a player should continue to play even though he is injured because actually pulling him out will be detrimental to the team result, but it may lead to an aggravation of the already existing injury in the player. Young athletes and children are at a particular risk for sports injuries because they have differing levels of physical and emotional maturity even at the same age. Also, children in particular may try to exceed their performing abilities because they try to compete with their peers and create an impression on others. Biological approaches towards the prevention of sports injuries would involve proper warm-up, taking proper rest breaks between games and also within a game, wearing the necessary protective gear, following proper techniques, playing safe by the rules, and developing proper muscular exercise and flexibility, and also developing a sense of team loyalty and mutual support. Stopping the activity in case of pain and avoiding heat injury by drinking plenty of water and avoiding practice or games in especially hot and humid conditions, as also wearing light clothing are some of the biological approaches towards preventing sports injury. Now we come to the most important part, which is the psychosocial approaches towards preventing sports injury. These approaches actually are directed towards reducing the amount of stress an athlete experiences in sports situations. These may include developing positive emotions when you go onto the field and clearing yourself of negativity and negative emotions such as the fear of performing well or an excessive spirit of competitiveness which actually turns out to be negative, as also removing emotional feelings such as anxiety, anger and fear during any competition. A healthy way would be to develop a spirit of healthy competition, as also visualizing positive and successful performances throughout a game. Other factors can be developing a sense of team loyalty, developing a mutual support system within the players and within the team so that each player becomes a support system to the other, developing mutual relationships of respect between the coach and the players, as also building up of other support systems such as friends, family members and significant others. The pressure to win no doubt can cause significant anxiety, and this is more when players are children. So we should give a special understanding to players when they are children, because we should understand that they experience a great deal of pain and anxiety and they are not as emotionally and physically well equipped to deal with it as adults. Further, young athletes and even children should be encouraged and judged on the basis of the amount of hard work and effort that they put in, and should not be excessively criticized or punished just for losing a game. Of course, it is true that in any sort of game, winning is important, and his performance causes the team to lose a number of times. Criticism naturally may arise. What we have to focus on is that the criticism is healthy and it helps the player to grow, rather than insulting him or making some kind of derogatory comments. Because we must always remember that the game is no doubt important, but there is nothing more valuable than a human being. So in today's chapter, you got an overview of what peptic ulcers are and what is the impact of stress in the causation as also the aggravation of peptic ulcers. Also, you got to know what asthma is, what are the causative factors for asthma, what are the possible treatments for asthma, and how stress can interfere with the occurrence of asthma. And for those of you who are sports persons, you also got to know how sports injury occurs and how stress is a major factor in the occurrence of sports injury. And this is something which you can take to your practical life. Make sure that whenever you go onto the field, you have a positive frame of mind and you also have a spirit of healthy competition.